next guest says there are a lot of lessons Canada can take from their experience. Dr. Larry Wolk is the state's Chief Medical Officer of Health, and he joins me live from Denver. Glad you could take the time, Dr. Wolk. I know that Canada has already picked your brain, so to speak, because you spoke with health officials last October up here in Ottawa. What was the lesson number one you shared with them?
Well, it's a little early to tell, although we do have 3 years of experience. But the bottom line is we haven't seen any significant issues or problems as a result of legalization. And I say significant, I think a lot of people were expecting to see large increases in adult use and youth use and increases in driving under the influence or hospitalizations or what have you. And we just haven't seen any of that. There have been a little bit of spikes here and there in the short term, but everything seems to really sort of have leveled off quite a bit.
And those spikes, what did you find in particular about them? Age group for those spikes, the people who were using it?
Yeah, I mean, we saw a spike, for example, in calls to our poison control center from parents who may have left their product out and their kids may have ingested it. But when I say a spike, we used to have maybe 50 calls a year, marijuana related, and it went to 150. So that's about a 300% increase. But it's still only 150 as compared to the thousands of calls we get as it relates to over-the-counter medications, alcohol, things like that. We also saw an increase in emergency room visits related to marijuana. But then as we analyzed it, most of those were attributable to people visiting from out of state or from out of country. So it really wasn't a baseline increase for folks who live here in Colorado.
Yeah, I think that's one of the concerns that some people have. Like we have ecotourism here on our West Coast, et cetera. Pot tourism, did you see that?
Yeah, so again, what we saw was maybe only about a 1 or 2 point increase as a result. But the number of tourists who would partake in the legalized market increased. So it didn't necessarily lead to an increase in the number of tourists, but it led to an increase in use amongst those who were already coming for other reasons.
A lot of parents have concerns about, oh my goodness, you're going to legalize this and all of a sudden my son or my daughter is going to be buying pot and smoking pot. They're going to be stoners. What did you find about the use of pot when it comes to young people versus, those who might be in their mid-30s, mid-40s?
Yeah, we just did not see an increase through a couple of different study tools. They validated the results. They validated each other, which was to say that, we started with about 1 in 5 teenagers admitting to prior 30-day use of marijuana, and it's still holding at about 1 in 5 teenagers, which means that 80% of teenagers still aren't using. And so I think teenagers make those kind of decisions for reasons other than just legalization or availability. And so it really hasn't been an issue for teenagers or even adults.
Final question for you, Dr. Wolk, and I wish we had more time, but this is the beast in which I work. Being stoned and driving. Big concerns here because, you can do those tests for impaired driving when it comes to alcohol, but how do we handle, what's your advice when it comes to handling stoners driving?
So, there are some roadside tests being piloted. Law enforcement is being trained on how to test for impairment. And really the bottom line is, we want to make sure that we're testing for impairment and making sure that impaired drivers aren't on the road, whether it's as a result of marijuana, prescription medications, alcohol, whatever the case may be. It's an imperfect system because when you do blood testing, as you probably know, THC can circulate in the bloodstream for weeks to more than a month. And so just because you have THC in your bloodstream doesn't necessarily mean you're impaired. So the focus really has to be on good tests for impairment, regardless of what causes it.
I want to thank you for your time, Dr. Wolk, and I'm sure we'll be talking again as we move further along with this legislation. Thank you.
My pleasure. Thank you.
Dr. Larry Wolk is the Chief Medical Officer for the state of Colorado. He joined me from Denver.